This is Dr. Vihan Sanyal. I'm a mental health specialist, hypnotherapist, master NLP practitioner from Sydney, Australia. I have worked in Australia for more than a decade before relocating back to India, and I have got all my qualifications from Australia, and I specialize in areas of anxiety, depression, relationship issues, marital counseling, children's developmental issues. So these are mainly what people see me for. I have recently collaborated with NDK Neurogram, and I was really intrigued and interested in the kind of work that they do, especially using Ayurveda, because I believe that the Ayurvedic method of treatment along with psychotherapy can work wonders in most of psychosomatic illnesses. And it's wonderful to talk to you guys today, and especially on a special day like World Autism Day, when we are encouraging people to come forth and talk about autism and autism spectrum disorder and what it is, and how do you identify a child who may be autistic. So today I'd just like to highlight a few things for parents who may not be aware of this disorder, and what to look for in a child, and get them evaluated in time. So if a child is facing issues with the communication, is the big aspect. Okay, if you notice that there's a delay in speech while other children are talking, but you find that your child is it's past their age to begin to talk, but they're not able to talk at all, or they only say a few words, or there's a repetition of a particular word over and over again. Also, when they're interacting, if you can just observe and see if there's any odd behavior that you can notice while your child is interacting with other children, and the child is not behaving in the way that the child should, like other children are behaving and playing. So if there's a difficulty in communication, if there is a repetition in a particular behavior, they're repeating that behavior over and over again, they're not interacting at the level as the other children are with each other. The other part is if they have an inability to maintain eye contact or to understand emotions. So if there's a lack of expressing emotions or understanding emotions, that's another key. So if you notice these in your child, I would encourage that you get your child evaluated at the earliest by a neurologist or a psychiatrist, and they can then diagnose mental illness. There's no special blood test or any kind of medical test that a medical practitioner can do and tell you that your child is autistic. Quite simply, you as a parent, if you can observe these behaviors and then just talk to your doctor or a specialist, let them evaluate your child, and then let them diagnose your child accordingly. So if you are such a parent, I would urge you not to panic. It's autism spectrum disorder is not an illness. It's a developmental disorder, so the child develops it. It's not something that the child is doing per se on their own. It's something which is happening to them. Okay, and there is a genetic component, of course, but before you go ahead and blame yourselves, try to understand that it could be, something which has come into the child, which has come from generations in the past. So either way, if you notice these disorders, I would suggest you go and you get your child evaluated. That's the first thing. There are various treatment options available in the market, and Ayurveda being one. Okay, so if your child is diagnosed with autism, they're likely to require some medication to help them cope with their symptoms, and Then there is the role of psychotherapists like me, who can come in and help them and help you understand why your child is behaving the way they are, what's happening, and what you can expect as a new parent coming in, especially. So firstly, to understand, if your child is autistic, you would require a ton of patience to deal with your child. You'll need a lot more patience than an average parent would in dealing with your child. It can be very, very frustrating at times when your child is repeating the same behavior over and over again, or is simply refusing to do what you're asking them to do. So there's a lot of love, care, support that is required. Even if your child is not, returning that love in the way that they should, try to understand, be patient, and try to help them. If you don't panic, if you are calm, and if you are patient, in time your child will learn the right way to behave. So it is best to reinforce the correct behavior over and over again. Okay, use your child's fixation to motivate them. That's another thing that you can do. So if a child is fixated on something, allow them to be fixated on whatever it is that they are fixated on in their behavior, and then gently spend time with them and help them to understand the correct behavior. That is the right way, instead of getting angry at them, or shunning them, or avoiding them. Okay, this leads to a lot more confusion in the child, because the child doesn't understand why you're behaving the way you are. Okay, and they most often they don't understand that it is not the right behavior. Whatever the behavior that they're doing is not the right thing. That's not the correct way to behave. Like I said, it's something that's happening to them, and they are confused to why they're not behaving in this like others. And most of the times they don't know the correct behavior and the incorrect behavior, and how to differentiate between the behaviors. So they're struggling there themselves, and the best you can do as a parent is be supportive and help them. There are a lot of skills that I can share with you, which can help your child become better at understanding their emotions, understanding the behaviors. And there are a lot of skills which I can impart to you as a parent through sessions, and you can go home and you can practice those behaviors with your child and help your child in this journey. Because to be honest with you, it is a long journey. It's not something which can be fixed quickly. It's not something which you take a pill and you get okay. Autism can last a lifetime. The thing to do is, some children cope with it better while others struggle. To understand how you can best support your child through alternate therapies like ayurveda, which has very little, if at all none, no side effects of the medications, and with supportive therapy, with psychotherapy. Okay, there's the wonderful tools available in psychotherapy, especially in NLP, and in behavior modification, and understanding how you can instill new behavior in children, and in this process make life a lot easier for yourself. So I thank you for this opportunity that you've given me to talk to you guys today, and I thank Neurogram for the wonderful work that they're doing, and especially Dr. Navdeep Sharma, who is heading and spearheading this organization and doing some excellent activities, and taking initiatives like a day like today, reaching out to specialists like us, for us to reach out to for our members, and see how best we can collaborate and help each other, and especially a larger community. So I thank you for this opportunity, and I look forward to speaking with you again in the near future.